Do you know how difficult it is for people with diabetes? Nowadays, the way diabetes monitoring their blood sugar level is by piercing the finger for blood sample. The challenges of monitoring by piercing routinely are the complexity and hardship of having to monitoring as type 1 diabetic patient or even serious type 2 diabetes needs to monitoring their sugar level not less than 4 times a day, which patient need to fast 8 hours before a meal, which the wound caused by monitoring must be treated well, and if not managed properly, diabetes can lead to serious infection and other diseases, and it can ultimately lead to death. It has led to the desire to develop a non-invasive device for measuring blood sugar levels.
Our blood sugar level detector will use infrared radiation instead of blood sampling. The device will incorporate up to 5 sensors. The first sensor will measure pressure to address the issue of inconsistency of finger placement, reducing errors. The remaining 4 sensors will emit infrared radiation at 2 wavelengths. These are near-infrared 940 nanometers, near-infrared 1300 nanometer. Before each measurement, the device will have a calibration function to measure without a finger present, to eliminate surrounding factors that may affect accuracy. Then finger will be placed on the device, providing the blood sugar level measurement.
Design structure. We will utilize both 940 nanometer and 1300 nanometer near-infrared radiation, and the near-infrared value will be collected. After that, the data will be sent to the ADS1115 and then to an Arduino with an AI which will predict the glucose value with the use of multiple feature and will be display the glucose level on an LCD screen.
We will begin by collecting blood sugar levels from individuals via blood sampling from hospitals. Then we'll use this data to train an AI and compare it to the values obtained from our devices using the machine learning technique. The device will start functioning when a finger is placed on it and a button is pressed. The sensor of different wavelengths will work at different times, while the pressure sensor will operate alongside the other 4 sensors. The data will be sent to the ADS1115 to amplify the electrical signals, then to the Arduino, which will convert the absorbed light values into blood glucose levels.
Principle that we use. Why can infrared radiation measure blood sugar level? Glucose absorb and scatter near-infrared light that penetrate tissue. Unabsorbed light can reflect or transmit through tissue. When light passes through organs with different glucose concentration, the received infrared intensity change due to scattering, lead to difference of value of infrared intensity of different level of glucose. By detecting and comparing infrared absorption to our dataset, we can detect glucose level. Why choose wavelength of 940 nanometer and 1300 nanometer? Near-infrared radiation with wavelength of 590 to 2380 nanometer can penetrate the skin of glucose, can absorb near-infrared light. Near-infrared has wavelength of 800 to 2500 nanometer. Train model. We collected data from blood tests of 250 individuals at Varee Chiang school. The tests were conducted at a hospital lab. Then we used a machine learning technique to build a model that predicts blood sugar level based on collected data. This model can be utilized from blood sugar level prediction. Feature. Our feature of the model include age, BMI, pressure value, near-infrared 940, near-infrared 1300, calibrated near-infrared 940, and calibrated 1300.
Avoiding blood sampling reduces pain and inconvenience during measurement. This motivates people to regularly monitor and manage their health, making it easy to plan and control blood sugar level. Additionally, it decreases the risk of infection from blood sampling, either from odor of self-inflicted. This innovation can expand the healthcare technology market following the Sorogo model. The tool will make it easily for people to monitor and manage their blood sugar level, reducing the need for blood sampling and making tests more convenient and painless, aligning with SDG 3.
And this is our business model canvas. 1. Segment. Patients requiring regular blood sugar level monitoring, especially those with diabetes or at risk. 2. Value proposition. A tool for blood sugar measurement without blood sampling. 3. Channels. Marketing through hospitals and clinics. 4. Customer relationships. Good after-sales service, such as usage guidance and maintenance. 5. Revenue streams. Revenue from tool sales. And 6. Key resource. Business partnerships with hospitals and clinics. 7. Key activities. Research and technology development. 8. Key partnerships. Hospitals and clinics for testings and tool uses. And 9. Core structure. Research and development expenses.